Thank you everyone for joining us today for the product showcase of the SimMan 3G Plus. We're delighted to have you all here with us this afternoon. My name is Nate Reitman, Product Marketing Manager for Laerdal. I'm joined here today by our colleagues in Norway who helped design and create the SimMan 3G Plus. For today's showcase, we will first review a clinical features overview of the SimMan 3G Plus, followed by a question and answer period where you can ask questions specific to the latest SimMan technology. Before we begin, I'd like to give some context regarding this new addition to the portfolio. Over the last 2 decades, one training solution has been there for learners throughout, so much so that learners, medical practitioners, and healthcare providers have come to know it by name, SimMan. SimMan has evolved over the years to help healthcare providers address new and unique training challenges. We've seen new challenges emerge in 2020 and in 2021 as a result of the COVID-19 pandemic. Now more than ever, the healthcare industry is challenged to do more with less. Simulation continues to offer learners the opportunity to rehearse real-world specialized training, something that otherwise might be hard to practice. As educators continue to address disparities in healthcare and to strive for health equity, using simulation to encourage culturally competent and equitable care can help to change behaviors and improve patient outcomes. Recognizing the need for diversity in healthcare training, continued development to the SimMan portfolio has included a range of skin tone options that reflect the diversity of real patients. Recognized as the world's most widely used advanced patient simulator, the evolution of the SimMan platform continues with the introduction of the SimMan 3G Plus, now capable of representing a diverse range of patients with improved clinical features to help prepare learners for real-world situations. SimMan 3G Plus comes equipped with technology to provide a seamless and stable network connection to ensure users run uninterrupted simulation sessions with confidence. In the current environment we find ourselves in, we recognize that doing in-person demonstrations may be difficult in the immediate future. It is with this in mind that we would now like to offer you a clinical features overview of the SimMan 3G Plus. As mentioned previously, we'll first begin with an overview of the SimMan 3G Plus, followed by a question and answer period. If you have a question or a feature you'd like to see more specifically, please type it into the Q&A feature of the Zoom located at the bottom of your screen. We encourage you to continue to ask questions throughout the presentation to ensure that this is an engaging and insightful experience for you. We'll get to as many of your questions as we can today, and we encourage you to follow up with your local Laerdal support representative after this is over. Now, without further ado, I'd like to introduce our speaker, coming to us from Norway, Senior Product Manager, Carl Ruben.
Thank you very much, Nate, for the introduction, and welcome to all the spectators. SimMan 3G Plus is a modular system. We've now built in more capabilities with regards to diversity and the ability to bring different elements into the mannequin and into the simulation. We're continuing to build a trustworthy, reliable, durable product, and we've added a new and a different look to the mannequin. So you can see clearly some of the visual changes on, for instance, the face skin. The silicone skin allows us, in addition to other things, obviously, to have more focus on the visual details. So you can see this one having a more realistic and nice look, and also provided in different skin tones. So examples of this. The other skin tones is the dark skin simulator. You can see a lot more, I don't know how close you can see, but you can see details in the skin, and you can see beard, and a darker skin complexion. And we have the medium tanned mannequin, looking slightly more tanned with the darker details, and could bring you a different look on the mannequin, obviously paired with the rest of the mannequin. Plan is obviously to continue producing more faces and more skins in the future. So the next skin on the list is a geriatric face skin. It's obviously the meaning by allowing to change skins that customers or users can do that by themselves. So we've added a function or a feature that allows customers to interchange the face skins more easily by themselves. We'll come back to that later. If we look at some of the details in the face, we can see that, for instance, the fluid ports that before was very visible is now not visible. So if you, Eivind, would activate, for instance, tears, so we can see that the appearance of fluid functions in the face is now different and more hidden and more natural looking. We can also activate sweat, so we can see water or fluids coming out of the forehead, and it looks more present and more attractive, I think. Okay, I'm going to just tilt the bed a bit down to talk about the Bvm Ceiling. We've done a lot of work with the mannequin and the underlying parts so that we achieve a good seal when we want to do Bvm. So a standard mask here, obviously you can use any type mask. We've tested with several different sizes and brands and with good results. So this is the standard Laerdal mask. The silicone skin is more realistic and feels more natural to operate and move, and it's easy to get a good seal here. So if you do the correct grip, you can see chest rise and a good bagging opportunity here. Okay, in addition to bagging, obviously we have some small changes to the mouth. So you can see it's slightly more narrow, looks visually a bit better, but it doesn't conflict with the ability to do intubation and several types of intubation. I'm going to demonstrate one of them. So a standard method of intubation is through the scope, open, and we've kept nice details in the airway, so I can see the esophagus and I can see the vocal cords to guide me. And I can do the intubation like that. Good. So, allowing for normal use of different types of intubation equipment. In addition to doing normal types of intubation, you can now use a nasal cannula. We've added more marked or more distinct ears, so it's possible to hang the cannula on. This is something that has been commented and wanted by many users. So now you can place the cannula like this and fit it over the ears, tighten as you should, and get a proper usage of a nasal cannula. Okay, so in addition to that, we have also kept or included the same feature as we have had with the ability to do a crack. So by using the neck band here, you can cut it open and insert, and by twisting or rotating the neck band, this can be used multiple times. Okay. We've also kept many of the very nice features when it comes to the structure of the airway. So there are several bladders and possibilities to change or obstruct the airway, so making it hard to intubate or more or less difficult to do the intubations. So it gives a good practice ability for students. Okay, we're gonna have a quick look at the LEAP screen. So when Eivind previously clicked on the fluids, so now you see the LEAP screen, and this is the standard opening window of LEAP. So LEAP is the operating system whereby you can control all features and functions on the mannequin. And it's a software that's been built and being not rebuilt, but updated and maintained for the last 10 years. And there's always coming out new features, new functions, and upgrades through the software. So this interface will allow you to control all and any aspects of the mannequin. Okay, so switching back to the mannequin, what we've seen so far is some of the visual changes and the features that we have kept. I mentioned airway obstructions. We also have the thumb edema, so that has different settings, and the vital signs which are linked into the system and the mannequin. They will also, so if you're affecting the vital signs, this will have an impact on the mannequin. So for instance, heart rate and cyanosis and different types of vital signs can be affected by toggling switches in LEAP. Okay, so I'm gonna slightly push down and switch over to the arms. So as you can see, we have two new arms on SimMan 3G Plus. They're both bilateral in functions, meaning that all procedures or activities can be done on each arm. We've added a lot of articulation on the arm compared to the previous one that was more stiff. Now we have a flexible elbow. There's rotation in the shoulder joint, in the upper arm, in the underarm, and there's movement in the wrist. So in total, this allows for a way more natural and sensible way of moving and using the arm. We've made some improvements on seizures and convulsions. So maybe you could activate convulsions. So now you can see a more realistic representation of seizures and convulsions. So that looks nice. Thank you, Eivind. Another benefit of using a new material on the arms, so we're doing the same silicone type skin on the arms as the face. It gives a more natural and good feeling when you touch it, when you operate it, and when you use it. We've included a zipper all the way on the arm. So this allows you to change the skin if need be, or open the arm if you want to do maintenance or change something in the arm. If you want to take out any of the bladders or the foam pads. So I'll come back to that. We've kept, obviously, pulses on the arms, but they are new, they are improved, more correct landmarks and more correct positioning, and the sensation of palpating the pulse is different compared to the the previous models. So this feels more natural and nice to touch. So there's one here on the forehand, and you have one in a brachial position or placement. We've also kept but improved and changed the IV port. So we now call that a semi-pre-ported solution. So this allows the student or the trainer to actually conduct the procedure of placing the IV. So you can do the full procedure as you would on a normal patient. And I'm going to demonstrate. Obviously, locating the placement of incision is very obvious. So that's not what you're training on, but it's more the sensation of doing the procedure and collecting the correct equipment and making the judgment of doing that to provide fluids. So so the angle is a bit strange as I'm trying not to block the view for you. It's just to show you the functionality here. So when I insert the needle in the pre-port, I can feel that I'm touching against a simulated skin. And if I continue to push the needle, I'll feel that I'll get through the skin and into the vein. And then I can draw back the syringe and continue to push in the venaflon, and then do the fixation of the venaflon and attach a IV drip on it to give fluids to the patient. So all in all, a more natural and realistic way of training on IV. So I'm going to remove that and have a look at the two new features on the shoulder area of the mannequin. So we've included a deltoid intramuscular injection site, a generous area for that, and in the same area a humeral IO, so you can feel good landmarks for where to insert the IO. Intramuscular injections is, as I said, a relatively large and generous area. So you can see and feel a normal or realistic resistance. And you can aspirate and insert fluids into a underlying pad. I'm going to take it out afterwards and show you how that looks. The skin itself, there will be no visible marks from such a thin needle as the intramuscular injection. So you can do this multiple times without damaging the skin. We've tested 2,000 piercings and still no visible marks on the skin from intramuscular injections. So that's a good thing. We also have, as I mentioned, a IO bone underneath. And I can feel the landmarks here when I'm palpating. Just to demonstrate, we can see a ECIO inserted in the crease, I feel the bone, and I can drill through the bone and get into the cavity of the bone. Remove the needle, and I can not insert, but what do you call that? Add fluids by the Laerdal system and push large amounts of fluid like you would through the normal procedure. So a good function there. And that concludes the new topics on the arm. We're going to talk a bit about the new torso skin. So as you can see, we've introduced. Oh, I forgot one thing. That's not good. Sorry about that. I forgot to mention the two new features on the arm that we are working on and happy to deliver as part of the realistic look and feel and more natural topics within simulation. We are introducing a new way of doing BP and a automated SpO2 function. So by use of real clinical devices, we can now measure the blood pressure, and I'll demonstrate. So as you can see, this is it's a standard GE monitor and a standard cuff. There is one small deviation from what's standard. We've added one tube on the cuff. So this would work like any type of blood pressure device that you would want to use. Attach the cuff as normal, like that, and then attach this tube to the port of the arm, and then click go, and the blood pressure will be measured and detected as per your settings in LEAP. Also included a clinical standard SpO2 device to be attached on the finger. So, and by then turning on the device, plays me a little tune, and you can see values coming up on the screen that shows the desired SpO2 and pressure of the mannequin. Okay, so yeah, as I'm removing this, I mentioned that I wanted to show you the inside of the arm. So in addition to the new features and functions, we've added, as I mentioned, this zipper. It goes the whole length of the arm. So this one can be opened when you want to do inspect or change or do modifications or change something. So the arm can easily be opened like that, and you can put the skin to the side, and here we see the pad where the intramuscular injections are set. Underneath this pad is the IO bone that can also easily be replaced. So when you use this bone, obviously you will pierce a hole in it, like I just recently did, and this hole needs to be plugged or replaced by a new bone if you want to have a watertight connection in this. So, but easy to operate, easy to open, and easy to replace. Just click on and click off. Like that. Put the skin back on. Okay. So the last thing I wanted to mention was the torso skin. So as you can see, there's two new studs here, and this live shock torso skin allows you to utilize any standard heart starter or defibrillation device where you can detect ECG, you can do pacing, cardioversion, and normal, obviously, defibrillation. You can use any types like the maybe the older version, the paddles, or these types of pads. So by placing the pads on the mannequin, we can now go to LEAP, and we can see the ECG measurements. And in the list that you see now on the drop down, there's several types of rhythms to choose from, some shockable and some not. So depending on the scenario you run or the simulation you want to do, you kind of choose accordingly. So it's a big register there of options and possibilities. Yeah. Okay. So with that said, all of these features and the things we've shown now will be possible to purchase as a upgrade option for mannequins produced after 2015. That will include the head skin, the interchangeable head skin, 2 new set of arms and a live shock skin, and a service to upgrade the product. In that, there will also be a new dongle, and the purpose of this dongle is to replace the existing network in the mannequin. We're adding a new and improved way of connecting to the net to provide customers with a more stable and good option to connect to a network. And I think that's it, Nate. If there's any questions or discussions, I think that's a good time to do that now. So over to you.
Wonderful. Well, thank you so much, Carl Rubin, for the great overview of the SimMan 3G Plus. I hope everyone has a clearer understanding of the exciting new features that this advanced patient simulator has to offer. We are now going to open it up for questions from the audience, and I saw a lot of questions already coming in, which is great to see the excitement in the questions. So please feel free to keep them coming. We'll be utilizing it in the Q&A feature of the Zoom to input your questions. So as we start to answer questions, if you have anything else you'd like to see, please feel free to let us know. Otherwise, Carl Rubin, the first couple of questions that came in here are in regards to the face and the head. So the first question that we have that came in here is in regards to the different molds and the new faces that are planned. How many do we have currently available, and are any in production for the future?
Right. So for the time being, we're releasing the 3 skin tones as showed here. And the plan is that while we release the product to market, we will focus to finalize the 3 next ones, which are geriatric. So obviously having each skin tone available for those. And then we're planning to continue to deliver faces as we go along. I don't have a fixed timetable for that, but a couple of releases each year. And we will listen to the market and listen to the customers to understand what are the priorities and what are the requirements. So this is something that customers can help us to decide and prioritize.
Wonderful. Thank you for that answer. The next question regarding the face is in regards to the different skins that come with it. Can they be used as masks over the original skin of the mannequin, or what's the functionality with those other head skins?
Right. So that's not possible. They're not designed to fit on top of a existing skin. So you do need to do a modification on the mannequin in order to utilize the new face skins. So that is a upgrade path. And there's several technical reasons for that. The new face skin needs to fit with the fluid system and the tightening to the airway and other technical features. So So the answer is no, it's not a overlay face. It is a brand new face that fits on the underlying structure of the mannequin.
Wonderful, thank you. And one of the other questions that came in, and I just wanted to highlight that the question was, do the ears allow for placement of nasal prongs, which I hope everyone saw in the overview that we could fit them over the ears as well. So I just wanted to answer that.
Yeah, no, that's absolutely correct. So that's a new feature on the ears now. So they are anatomically correct shaped. So you can use the nasal tube, yes.
Great. Another question in regards to the nose. Do the nostrils only have one functional side for insertion of devices, such as NPA or nasogastric tubes, or two?
Yeah, that's exactly correct. There's one opening in the nostrils now, so the other one is tightened in, or what do you call it, occluded, since there's now a fluid port in the nose. So the right nostril is to be used for various type intubations.
Great, thank you.
Mm-hmm.
The next couple of questions we have are in regards to IV. So in regards to the IV's capability, is there an IV port on the right arm as well as the left arm? First question.
So that's a yes. All features are bilateral. So there's an IV port on each arm. So any of the features on a mannequin is similar on right and left arm.
Wonderful, thank you. The next question regarding IV is there a capability to hang a bag of fluids and allow fluids to run in through the IV?
Yes, absolutely, definitely. There's tubing on the inside of the mannequin, and there's a nipple on the underside of the arm where you can attach what do you call it, a quick lock, and put on a drain bag so you can collect the fluids. So the fluids obviously have to be drained out of the mannequin, and that happens through that nipple, and you collect the fluid in a drain bag. So yes, it's a vet system.
Excellent, thank you. The next question regarding the IV catheter is it a simulated one, or what gauges can be used for the IV?
Yeah, so it's not, you're using real syringes, and starting with 14 gauge, which is a very thick needle that allows you to push huge quantities of fluid, and up to standard sizes on 20 to 23. So no problem with the smaller sizes, obviously, but the biggest needle that we've tested and used is 14 gauge. That should be sufficient, hopefully.
Yeah. Great, thank you. We have two questions next coming up regarding the blood pressure. Actually, several questions came up regarding the blood pressure when we reviewed that feature. So yep. The first question is regarding the blood pressure cuff. Are there different cuffs available for different machines, or is it a clinical blood pressure machine included?
Right, so the machine itself is not included. We will supply, together with the mannequin, it is a clinical cuff, but it's slightly modified by Laerdal to be used with the mannequin, as I explained earlier, since we need to attach one tube to the mannequin. With the acceptance of this small, short tube and the connection to the mannequin, everything is similar to what you would use on your standard machine. So this cuff will be supplied by Laerdal, since it's slightly modified, and it will connect to any brand monitor that you have. So you will receive this one, and through a connection, and we will deliver several connectors to ensure that it would fit your brand monitor. And if we, by some instance, don't have the exact correct connector, there is a possibility through our services to help you facilitate and find the correct tubing. But we have already a standard kit that follows the product that will fit, as far as we know, the market. So.
Wonderful. Thank you for that answer.
Sure.
The next questions, there's a couple in regards to manual blood pressure. So is it possible to do manual blood pressure with the SimMan 3G Plus, and is there any attachments that would enable that?
Right. So the new arms are created for and with the thinking of utilizing automated blood pressure machines. So you cannot use the manual Kortokov sounds and the manual way of doing it. But obviously, SimMan 3G Plus will fit the arms of the standard SimMan 3G, which have that capability. So so the answer is, I guess it's yes, but you do need to utilize the old arm, because there you have the functionality or the feature to utilize the manual blood pressure. But the exact answer to the question is that manual blood pressure cannot be measured on the new arm. You need to utilize the automated system.
Okay, thank you so much for the answer there. While we're on the topic of blood pressure, I did see one more come in, so we'll ask that now. In terms of the bilateral functionality of the arms, does that mean that blood pressure can be taken on both arms as well?
That is exactly correct, yes. So
just saw that one, and I wanted to, while we're on the topic, get all the blood pressure questions gone through, right?
It's great to hear this. There's a lot of questions and enthusiasm about blood pressure, and it seems to be a good development and what the customers are asking for and wanting. So we're excited about this. Absolutely.
The next question is in regards to the skin. What types of tape adhere to it, and is there any guidelines that we have around that?
Right. Yeah. So silicone skins and tape is a problem, and I'm sure everybody is aware of that. We are working with different solutions to add additives in the solution or the silicone mix to make it more tapeable, to call it that. In addition to that, we are delivering a specific patch that can be used around the IV area and also on the humeral side, which is a silicone transparent patch that you can glue on the skin, and it will look almost invisible. And this silicone patch is tapeable. So it's a fix to allow for taping on the skin. But we're hopeful that we in the future will kind of create the correct silicone mix that allows for taping better than silicone does today. But we have a solution for it, for the IV, so that you can use, for instance, the Tegaderm or the IV specific band. So it will attach and secure the syringe.
Wonderful, thank you. While we're on the topic of the skin, another question came up, and this is regarding how does the skin handle staining from moulage or other marks made from the learner?
Yeah, so since it is silicone skin, it's super easy to clean, and you can use permanent markers or ballpark pens and write and draw on the skin, and it comes off super easy with a mannequin wipe. So just a standard ethanol solution, and you can wipe it clean. So this one can be written on, and you can write in the face or in the arms, and there will be no staining. So that's it's a good quality of silicone.
Wonderful, thank you. We had a question come in regarding the IO feature. So the question is regarding how much fluid can be pushed into the IO feature without worrying about filling it up too much, or does it drain like a normal IV space?
Right. So the answer is yes, it does drain. So there is no limitation to the amount of fluid that you can push through. So similar to the function of the IV port, there is there's tubing connected to the IO bone that goes out in a port on the similar site as the IV port. So you can see here two openings, so one for IV and one for IO. So by using the same function as with IV, you attach a drain bag through a barb fitting here, and you can push fluids through the IO bone in a high speed and in the quantity desired.
Wonderful, wonderful, thank you. This next question is in regards to the face, and I know you briefly touched on it just before, but regarding the bag valve mask seal, could you please just go back and highlight what the improvements are on that and how that helps create a better seal?
So compared to the old 3G, obviously one of the big improvements is the silicone skin. So it's more flexible and easier to achieve a tightening on the actual skin itself, since it kind of fits better with the mask. So that's one thing. And we've worked with the underlying geometry on this area to stabilize it, to allow for the pressure from the mask. Further, we've worked with the air tightness in the system on the inside of the airway. So combined, all of these actions results in a lot better air seal compared to the previous version. So personally, I'm not trained in doing bagging, but for me, it's easy to do this in an airtight manner.
Wonderful, thank you for that. The next questions are in regards to defibrillation. So the first question is asking what kind of defibrillation pads can be used on the SimMan 3G Plus.
So you can use any type clinical standard pads, or you can use the old type paddles. It's not brand specific, so you're using a live, real pad, like the one you would have in your normal crash cart. It's not brand dependent, so it will work with any type standard live defib pads or paddles.
Wonderful, thank you. And then the next question regarding defibrillation is in regards to anterior-posterior placement. Is that possible with 3G Plus?
So 3G Plus is delivered with the same feature or functionality as we have on the other mannequins, meaning not AP position. We've received this question several times now, the last half year. Unfortunately, not a part of 3G Plus at the time being, but we are looking into ways of mitigating this feature and function. And it's high on the priority list. So when 3G Plus is released, we are going to continue to look for possibilities to solve that specific feature. But on SimMan 3G Plus, that's not a feature now in the beginning.
Wonderful, thank you. Another question came up regarding defibrillation while we're on the topic. Can you do demo pacing with defibrillation?
Yes, absolutely. So it contains the same functionality and features as we've had in 3G. So you can do pacing and you can do all the standard cardio version, and you have a huge list of different rhythms that can be shockable or not shockable. So it's a rather extensive library of different states that can be simulated. And pacing and cardio version is obviously available.
Excellent, thank you. Next question is in regards to chest tube insertion. Does this have chest tube insertion like the SimMan 3G?
So yes, the answer is yes, and there's no change to that feature. So it's similar to what 3G had. or has.
Excellent, thank you. We had a couple of questions as well regarding the lungs. So does this work with a mechanical ventilator, and does this work with the ASL 5000?
Right. Yes, it works perfectly fine with ASL 5000, and to do advanced ventilation management training, that would be our recommendation. Obviously, it is possible to connect SimMan 3G directly to a system or a ventilator, but it's not going to give you any good results. There's no built-in functionality from the bottom in the mannequin that gives you good readings or a good match directly on the ventilator. So if you want to use the mannequin for ventilation management training, we would recommend using ASL 5000.
Great, thank you. The next question is in regarding to catheterization. I believe it's Foley catheterization. Is that possible on this mannequin?
Yes, it is. It's the same functionality and feature as it was before, so there's no changes to that. SimMan 3G Plus comes with both the male and the female genitalia, and it's possible to do catheterization of both. And there is a fluid output, and there is sensorization to tell you that the catheter is in the correct position.
Excellent. A couple of questions regarding the IV as well. So is there flashback in the chamber during IV establishment?
No, there is no flashback from fluids in the system. So as you insert the needle and pull out the membrane, you're not going to see the flashback of blood since the system is not pre-filled with fluids. So that functionality is not part of the IV function.
Got it. And a follow-up to that then, is it possible to draw blood in any capacity?
No, there's no capacity for doing that specific task. We don't have a reservoir to draw blood from. There is obviously fluids in the system, so it can bleed and sweat and all the features that you are aware of, but there's no reservoir to draw blood from.
Great, and it seems like our listeners want to hear more about blood, so we'll continue on that topic for a moment. Can we actually hang blood or simulated blood products to run through the IV of the SimMan arm?
Yes, not a problem. So that would be same feature or same function as if you add standard IV fluids. You can also add simulated blood into the system. Obviously, we recommend that when you finalize your simulation or your training, that you flush through the system to clear out any residue that might clog up the system after a while. So a standard or a thorough cleaning procedure is recommended, but it's no problem to use simulated blood in the system through the tubing.
Excellent, thank you. We have two questions in regards to the pulses. Where are the pulse points, and which ones are bilateral?
So for the whole mannequin, there's several ones. The new arms have a placement radial and brachial here, and those are both bilateral. Then we have the carotid pulses on the neck, bilateral. We have femoral pulses, bilateral. There's propiolytic, or what you call it, the ankle and the lower foot pulse on both feet. And you have one pulse on the backside of the knee on each foot. So all pulses are bilateral. So 2 in the arms, the neck, the hip, the knee, and 2 on the front foot.
Excellent, thank you. We also have some questions regarding the network connectivity and the dongle. Could you please elaborate on the enhancements to the network connectivity and also how the dongle is connected?
Right. So in SimMan 3G Plus, we've removed what we refer to as the white router. So that's the white router was a built-in router in the mannequin. The white router is of old age and doesn't deliver the capabilities that we would want and expect from a new network solution today. So that's why we've changed it. So the router in itself is out of the product and it's replaced with a dongle. And this dongle is a network dongle, and it listens for and connects to a enterprise network or a external network. The speed and the signal strength is better than the previous system, and it's of more modern protocols, so you can utilize more modern equipment. So that's the reasoning behind changing it. It also gives meaning in a bigger context, because many of the places today would have a network available at their facility. So it just makes sense to connect your product to the existing network rather than continuing to create a specific network for the simulator. But there would be several options on how to do this. So we will deliver as a standard solution the dongle to connect to an existing network, but there is options to purchase a router from Laerdal or use your own router to connect to if you for some reason need to create a local or an ad hoc network. And there's a third option that you can have a battery operated router that you can use outside of your facility if you for some reason want to do something outside or in the woods or kind of excluded from the enterprise network. So it gives us more stability, it gives us more options, and it gives us a more modern networking capability.
Wonderful, thank you. So the next question we have is in regards to SimMan 3Gs and the upgrade possibility to a 3G plus. Do you mind just reviewing the criteria for what units can be upgraded?
Yeah, it's a very simple and easy criteria for that. It's a date. So if your mannequin is purchased in 2016 or later, it can be upgraded. We have a very specific serial number from when it starts, and I don't remember that number in my head, but we will give you very specific information on this. But as a general rule, if your mannequin is produced in 2016 or later, it can be upgraded. There's a few before 16 that can be, but that's based on the serial number. And if you're in doubt, please connect with us and we'll guide you and help you find the correct answer for your mannequin.
Excellent, thank you. And folks, I just want to mention that we do have about 5 minutes left, so we'll try to answer as many questions as we can. If there's anything we can't get to, we encourage you to follow up with your local Laerdal support representative, and they can get you the answers that you need. I saw a couple questions specifically as it relates to pricing and things like that, so we're more than happy to work with you on that, but we do want to try to get to a couple more questions before we finish up here today. So one of the other questions, Carl Rubin, came back regarding the face skins. So kind of two questions, actually. So one, is there any other diverse face skins in the future? Someone requested female face skins as well. I know we touched on this briefly, but just kind of circling back on that.
Yep, it's a topic that interests many people, I understand, and since we now have created the ability to change faces on the mannequin, I guess the desire and the want for more diversity and more interchangeability arises, and that's natural. As I mentioned, we're starting with, for the light skin, this phase, and there will be a light skin geriatric phase coming up shortly, and that's correct for all the three skin tones. When it comes to what phase to produce after geriatric, I think the answer isn't written in stone. We have options. There's female phases on the list. There's different trauma phases on the list, and it would be phases with other ethnicities. Again, this is where we need some help and some discussion and some understanding in the customer market to see what's the need, and it would obviously be something that's commercially beneficial for us and for customers, and would be what's interesting, and so this is a discussion that we can have going forward.
Wonderful, thank you. And I'm sure you'll be hearing from me as our customers here in the US, bring their thoughts to light. So we definitely encourage that. We encourage as much collaboration as possible. Please work with your local support representatives, and we'll do our best to, incorporate your feedback. So thank you for that answer. One other question that we got here is in regards to the simulator. Does it have anterior and posterior breath sounds? And does it also have auscultation focus to turn off the mechanical sounds?
Yes, it does. So, and that's similar to what 3G had before. Those features and functionalities are kept on. So there's speakers in the torso area and also on the backside that mimics the sound of lungs, also including heart sounds. Yes, there is a specific auscultation focus. So when you flick that switch in LEAP, you shut down all the other mechanical sounds in the mannequin. So you get a good focus to listen for the sounds that you're looking for. And again, we have a rich library of sounds when it comes to both breathing sounds and different heart sounds.
Excellent. Well, I think we're going to take one more question and then wrap it up for the day. So thank you all so much for your time. We're just going to do one more question here. So the last question that we'll do for the day is in regards to ECG. Does the 3G Plus allow for ECG to be accessed, or does it have set ECG rhythms?
It has the same features or functions as SimMan 3G Plus. So yes, there are connectors on the torso that you can place ECG and get readings as you would do in prior simulation. So there's no changes to that functionality. It's a good functionality, so it works as intended. So we're keeping it for future simulators. Or SimMan 3G Plus.
Excellent. Thank you so much. So we are just at the top of the hour here. So I want to just take a moment and say thank you all so much for your engagement today. Thank you all so much for taking the time to join us. We hope you learned a little bit more about SimMan 3G Plus today. We did not get a chance to get to all of your questions, but we will take a list of the questions, we'll get them answered, and we'll send them out to your local support representatives to follow up. So we'll make sure that those additional questions get taken care of for you. We had a couple questions come in about reviewing the recording. We will be sending that out to you. So keep an eye in your inbox, and there will be a link of today's recording. If you would like to discuss pricing, any options, or you need a formal quotation of SimMan 3G Plus, we have a link that you can follow. So the link should be on the screen here. It's laerdal.com/SimMan3G. There's a form there that you can fill out a request for more information, or if you know your local support representative, you can feel free to reach out to them. If you don't know who they are, please drop in your zip code in the Q&A or in the chat, and we'll get that squared away. But I just want to take a moment to thank our colleagues over in Norway. Carl Ruben, thank you so much, and the entire production team there for helping us out with today's event. To our customers, again, thank you so much for joining. And this concludes the product showcase for today. We hope you have a wonderful rest of your day and a wonderful rest of your week. Thank you so much.
Thank you.